Good morning, everyone, and thank you, Alicia, for that very kind introduction. And I thank all of you for taking some time to come listen about HCV. I think if you're at Gilead and haven't heard about HCV, you're living under a rock. So I am a medical scientist, and it's really been a great honor and pleasure to be part of that team. To work on 2 launches with Sovaldi and Harvoni have been, phenomenal. And every day, we're out in the field talking to doctors, and really the reaction has been overwhelming and really, sort of game-changing. That doctors telling you stories that they've cured patients that they've had in their practice for 20 years at a time, and just to see that joy in their face and to have a small part of that is really wonderful. So here are the objectives of my talk. First, I'm going to talk about how hepatitis C differs from hepatitis A, B, and HIV. I know as part of the Gilead 101 series, my colleagues have talked about hepatitis B and HIV, but we'll do a quick refresher. Next, how the virus is transmitted, what are the risk factors, how it could be prevented. Epidemiology, both globally as well as here in the United States, and what can be done for screening efforts. Next, once a person is screened, how do they diagnose and evaluate a patient? And then my favorite part will be the overview of hepatitis C treatment and talk about what we're doing here at Gilead. And then lastly, a few comments on raising awareness about hepatitis issues in general. So what is hepatitis? Hepatitis means it's an inflammation of the liver. Basically, the liver is having cells are dying, and it's in response to foreign substances. So this could be certain drugs, fatty liver disease, too much alcohol use can damage the liver, as well as viral infections. So hepatitis is also the name of a family of viral hepatitis infections, and there's many kinds, I think A through G. The most common in the United States are A, B, and C, and certainly today we'll focus on hepatitis C. So first, just to differentiate between A and B, let's look at transmission. So hepatitis A is passed through the fecal-oral route, so usually from contaminated water or food supply. So every now and then in the news you'll hear of restaurant outbreaks of hepatitis, and it's hepatitis A that's being transmitted. Versus hepatitis B and C are transmitted from bodily fluids of infected persons, and mainly it's blood contact. Long-term effects, hepatitis A is self-limiting, so usually it's an acute infection and patients recover. Versus hepatitis B and C, the majority of patients go on to have chronic disease. As far as vaccinations, you can be vaccinated against A and B, which is the good news. And to date, there's no vaccine for hepatitis C, but I'm confident that will happen in my lifetime. So just to give you an idea, hepatitis is of course a virus, and it requires infecting living cells to stay alive. On its own, hepatitis C can only survive 16 hours to maybe 4 days. If you compare that to HIV, however, HIV only lasts moments. So that's important when you think about how easily the disease is transmitted. So HCV is transmitted 6 times more readily than HIV. And one of the main things I want to leave you with today here is that hepatitis C can be cured. And so unlike HIV and hepatitis B, hepatitis C can be cured. And so you see this picture of a person who is acutely infected, and there's a lot of virus in the body. They go on to develop chronic infection, and virus still remains. But with successful therapy, you can see that we can completely eliminate virus, and a patient is considered cured. And we'll get into that more in the treatment section.